I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of IDD Health Matters. Our guest today is BJ Stasio. Welcome, BJ.
Thank you for having me.
Absolutely. So BJ, I know you do all kinds of things in the field of supports and services and advocacy for people with intellectual and developmental disabilities. Tell us some of the big things that you do, some of the exciting things that you work on.
Well, I work on rights for people with, IDD and developmental disabilities and kind of teach them to speak up for themselves. While speaking up for themselves, they also learn it's important to speak up for others and give back.
Why is that important, that they speak up for themselves?
Well, I want to preface this by saying this is my opinion alone and my belief. I believe that the systems which provide us services are great. Some need work, some don't. But the systems that are in place make us look to the outside society as we're taking and not giving back. That's why I feel it's important that I leave that message of, okay, now we have to give back by sharing our knowledge or doing a good thing like having a bake sale or something to help somebody out if they need it, that type thing.
That's a perspective I never thought about, but I get that people often may perceive that people with disabilities are just takers of services.
Yes.
But really, they are important members of society, and we all contribute in our own ways.
And I want to remind the audience that we need those services no matter what part of the country we live in to help us live the best lives that you get to have. We just need a little assistance to make that best life happen.
Well, honestly, we all need support in life in different ways. Every human being relies on other people, unless you live maybe in the woods with nobody around. But we all need support of different types in life. And some of us need a little more and some of us need a little less.
Yes, and I don't believe in the term, I'm an independent person, because I'm interdependent on somebody else to help me get the independence that I sometimes need to do the things that I desire and want to do. Like, I can't fix my car that I came in. So
I can't either, so
I have to go to a mechanic. We all have to go to a mechanic if we don't know how to fix something. So we're interdependent on that mechanic to fix our mode of transportation.
That's right. And so sometimes some of that interdependence might relate to what would be some things that you say it might relate to in your world, in your life?
Well, for me, the interdependence is getting out of bed because I need help getting out of bed. I utilize a Hoyer lift to get out of bed, and I'm total assistance with dressing, which I'm not ashamed to say. With my one arm usage, I'm right side dominant, so one arm is all I got. It would probably take me 3 days to put the pants that I'm wearing on, and I would miss out on everything. So
you get some assistance with lots of different things so that you can live a life that you want to live.
Yes, absolutely, yes.
Good stuff. Now, I know that you do a lot of advocacy work. There's a couple of organizations that you work with. Can you tell us about those?
Yes, I work with IEC, which we're working on getting like a roadmap to better health for people with IDD, so physicians and clinicians understand how to better service those with IDD and developmental disabilities who need their services. So
just for the audience, I want to define IEC. It's the Institute for Exceptional Care.
Yes.
That's a great organization to work with. And you meant talking about physician training, which you already know is very near and dear to my heart.
Yes.
So we'll probably come back to that later, but tell us about some other groups you work with.
Well, I also, work with the National Federation for Just Communities in my area of Western New York. It's a social justice organization because I'm all about social justice for all people, not just for people with disabilities, because social justice gives us the better communities that we all desire to live in, because a lot of things we're talking about today here at this conference, which is where we both are, is about being included in the communities in which we live. Because in my opinion, so many times people with disabilities are excluded just because of the way they look or the help that they need.
Right. And you mentioned conference. We are coming to you from the NADSP, the National Association for Direct Support Professionals conference in Pittsburgh, Pennsylvania. Important organization that addresses and helps to promote direct support professionals as professionals and provide training and education and grow that field of supports and services.
Yes, and my direct support professionals that I have working for me are awesome people, and without their help, I wouldn't be able to continue to do the work that I'm doing or my professional job, because I happen to work for Office for People with Developmental Disabilities in New York State, which is the overseer in New York State for people with IDD, the overseer of services.
So what are some of the things that you do with them?
Well, I've designed some programs over the years, like the Right of the Month, where we talk about you have this right, for example, the right to vote. You have the right to vote, but I also put a spin on it and talk about the responsibilities that come with voting. One of the big responsibilities is to go out and get registered to vote. And then once you do that, you need to understand the candidates and the issues to the best of your ability that you're voting for. You don't just vote for somebody because you like the way they look or like the way they talk on TV, because once you vote for them and they win, they work for you. So you have to know who they are, what they stand for as it relates to the issues that are most important to you. And obviously, to me, one of my big things is disability issues. What are their stances on disability issues? How will they support me as a constituent with a disability?
Right. It's important work.
Yes.
So I think we talked earlier, you are also part of another organization for advocacy in New York State. Tell me about that organization.
Yes, I'm a part of the Self-Advocacy Association of New York State. I'm on the board of directors. I'm the co-vice president, a past president of the organization, and it's an honor to be a past president with some of the legends, I feel, in the disability community in New York State. And it's an honor to be among them. It's an honor to be considered a leader. And I want to say thank you for all the work you've done. And I'm carrying on your legacy by being in the position I'm in. And I'm grateful for the opportunity. So thank you.
That's excellent. So we've talked a lot about the various things that you do, and there's probably 150 more that we could talk about. Yes. But let's talk about BJ. Who are you, BJ? Tell us about yourself.
Well, I've lived in Buffalo, New York all my life, and I've always been a guy who likes to try new and different and exciting things. Just because I have a disability doesn't mean that it stops me. The only thing that stops me is when my battery dies and I forget to charge the chair, then I don't go anywhere. So that's the only thing that really stops me from doing what I need to do, because I realize through some medical challenges that I had over the years, I have one life to live, and I'm going to live it to the fullest extent of what I can do. And to go back a little bit, my direct support professionals understand that that's important to me, because I want to make a difference in other people's lives, or help them realize that they do matter to someone, because we all are human beings, regardless of whatever our challenges or disabilities are.
We're people first.
People first, yes.
We were talking earlier a little bit more about your personal life, if you care to share it. You had an interesting story about how you met your wife.
Yes, as I told you, and it's funny always telling this story because it kind of gives me that warm and fuzzy feeling inside, because I feel I'm one of the luckiest human beings on the planet to have the opportunities that I've had in my life. And I had an opportunity to meet someone again who turned out to matter great deals of my life, and I love her very much. She's my wife now, but I met her when I was 10 years old at a camp for disabled and disadvantaged economically children. Some were ambulatory, some had an obvious disability like myself and used a mobility device. And I was on a baseball diamond by myself, and my wife Amber, or 38 years later, my wife Amber she was 10 years old like I was, and she was at a neighboring camp, so they would have the neighboring camp come visit the camp with the disadvantaged and disabled campers. And I was always the type, and still am, to want to do things by myself. I don't need somebody by my side every waking minute, because I like my private time, my alone time to do things. And I happen to be a big fan of baseball. I've always loved baseball. So I was on a baseball diamond by myself, imagining that I was, what was then like Jim Rice from the Boston Red Sox, or, Billy Buckner from the Boston Red Sox. I love the Boston Red Sox. So I was imagining myself as those guys. I was only 10 years old. I've always loved the Boston Red Sox. So Amber came over, saw me, and wanted to play with me. And the counselor that was from that other camp said, "We don't play with those people. You don't play with those people. You play with your own people." And she was emotionally crushed by that, because she wanted to get to know who I was and play with me. So I saw the kids picking on her, that she was visibly upset. So I put the bat between my legs, took off, and started chasing after those kids with the bat, because I didn't like that they were picking on her. And that was the last time we saw each other, up until probably almost 30 years later, by happenstance. I was training a week at my job site where she was, for training herself as a Medicaid service coordinator then, and we just kind of hit it off and clicked, because one of the trainers was having trouble with some equipment, and they asked me to come down to help, and it turned out the equipment wasn't plugged in, which is rather funny. But
it's happened to a lot of us.
Yes, it's even happened to me, so I get it. It's one of those things where, there was just something about her and couldn't figure it out. And like 3 days after we met, I had a stroke due to a mistaken medication overdose from the physician at the time, not listening to when I said I had a headache. I wasn't feeling well. So that night after the appointment, I went home and had a stroke and woke up a month later. And one of the most interesting things my sister said, who was a nurse, and she's always been a nurse because she wanted to take care of her little brother, and she did a great job helping me through the stroke for that time, and I appreciate that as well. But one of the things I said while I was in sleep state, or kept saying, was the word Amber. So when I came out and was able to fully communicate again, she asked me, who was Amber. I said, I had no idea. I needed to clear the cobwebs and just kind of let my brain reset, because I was sleeping for so long. And then after I figured it out, I remembered her number and started calling her and saying, "Hey, it's BJ. Can we go on a date now?" She's like, "No." So I didn't give up. I'm very persistent. So I waited a couple weeks. Can we go on a date now? And I am grateful for her friends, because her friend said, "Go on a date. It's not going to mean anything. You're just going on a date. It'll make them happy. It'll be a nice thing that you could do." And it turned out to be probably one of the most interesting and destiny setting nights of my life, because I usually don't show pictures of myself because I'm rather embarrassed by all those pictures, and still am when I'm in the public eye and I see myself on TV speaking for others on behalf of others. I am visibly embarrassed. I don't like that. I don't enjoy that. So when it got to a specific newspaper clipping when I was 10, because that day we met, there were some newspaper reporters there, and they asked me how I enjoyed the camp, and I told them, and they took a picture of me, and she saw that picture and she started crying. And I remember what I said. I said, "Look, I know I was cute then, and I'm probably not that cute now, but what are you crying about?" And she said, "You were that kid I always wondered about, the kid I played with that I wanted to reconnect with, and here we are." So I guess it was destiny that we started dating, and a year later, I asked her to marry me on her birthday.
Yeah.
So her birthday means an extra special thing, because that was the day I proposed. But of course, I had to get my jollies out of it too. My life is short, short but strong, a strong woman. So I said to my staff, I want to go get a ring. I want to ask her to marry me. So it took me to a jeweler, bought her a ring, and I put it in a box at the top of a closet. So she had to use a stepladder to get it, and it was like 13 boxes. I remember like it was yesterday. We actually filled 13 boxes with stuff, and the last box had the ring in it. And when she got to the box with the ring in it, she got to the small box. I said, "Before you open it, I have a question to ask you." She said, "What?" "Would you marry me? Happy birthday." That was probably one of the greatest and most freeing moments of my life.
And that was 16 years ago now?
16 years ago.
Wow. What a beautiful and amazing story, but an unbelievable coincidence that girl from 10 years ago at the camp ended up being the person that you met and fell in love with and married.
I believe, as we were talking earlier, I believe God had this laid out for me, because God and I always talk, and I don't talk much about my religious beliefs, but I believe it's important for me to say now at this stage of my life that nothing I do would be without the guidance of my faith and my religious belief and my belief in what God wants for me. God doesn't want me to sit in a corner and wallow and say, "Woe is me." He wants me to make the world better for other people, because He has given me so much. And I am hyper aware of that. I'm probably more aware of that than I am of my own disability, because sometimes I forget that I have disability because I'm so focused on the things I need to do that I feel matter. Sometimes I forget that there's obstacles in my way to get to where I need to go, because I have bruises on my legs from not paying attention, because I'm lost in that thought of what I need to do to make somebody's life better.
BJ, we were talking about the first time we met, and it was mostly Zoom type meetings and stuff, when we kind of both, we had a little connection there, some kind of way. I think we were able to relate to each other in a way, and just hearing you talk even more, it's just, you're an incredible guy. There's no doubt.
Well, thank you. So are you, and so I referred to you as a fluffy pillow that I could actually relate to and get comfortable with, because so many times in lives where people with might not have an obvious disability talk to us, they forget to keep it at the simple, easy, understandable level. And the first time I heard you talk about something that you were asked to talk about, I understood what you said right away, and I appreciate that. And it made me feel a comfort to actually speak what I needed to speak. So thank you for that.
That's very kind and very heartwarming. Thank you, BJ. I appreciate that very much. So there is something that I do with every guest that I didn't warn you about beforehand. So I ask all of the guests to give me, I call it 3 and 3 things in about 3 minutes that you want listeners to know that you think will improve the world of either health and wellness or supports and services for people with intellectual and developmental disabilities. So what are 3 tips, 3 words of wisdom, 3 pieces of advice that you would tell the audience?
Well, believe it or not, for me, 3 minutes, 3 things is actually hard, because that's the 3 things I always start out with whenever I do keynotes or tell my story or something, because it's never about me. The 3 things are: you have a story, tell it. And it might not be perfect the first time, just tell it. Just tell who you are, tell what matters to you, so they make that human connection. And don't stand on the sidelines looking at the parade go by. Try to make yourself a part of the parade so you feel like you belong somewhere, because when you're on the sidelines, you don't get heard. You just get looked at and not taken seriously. So your opinion matters. So make your voice heard, because you too can create the change that you want for yourself and others. Your story matters. So please, 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 whenever the opportunity arises, tell it.
Telling your story.
Yes.
Is that number 1?
That's number 1.
All right.
Number 2 is be who you are. Don't be somebody that you think they want you to be. If you're upset in a day, like I get upset a lot, I'll tell you, because I'm very hard on myself when things don't go well. But just be who you are and be okay with that. Don't be something you're not. Don't try to be, in my case, and this is what I say about myself, don't always try to be the nice and forgiving disabled guy, because if something is bothering you, be okay with that and share that with those who matter to you, because they can probably help you with it.
I love that.
That's number 2.
Be who yourself. I'm sorry. Tell your story, be who you are, and
just be okay with it. Be okay, like, if you get upset, because you're allowed. Just because you have a disability doesn't mean it's sunshine and rainbows all the time. None of us should be like that, because we all have obstacles that come in our life, and it's all how we handle those obstacles. Like there are days when I want to give up, but I realize I can't, because it's not who I am. Because I think I would be more upset if I said I gave up at something or just gave in, and that's not who I am, so I don't do that.
Wonderful things, wonderful pieces of advice for everyone out there that really relates to parts of all of our lives. It's really advice for everything. The advice for living, I would say.
Yes.
Yeah.
Living your best life.
And to put it another way, I've heard it, living a life you love.
Yes.
That's an incredible thing to have the opportunity, that we all have the opportunity to do.
And if your life doesn't go well one day, remember that you're always given tomorrow to do it over again.
Yes, there is. Wasn't there a great song about that? Something about the sun will come out
Yes.
tomorrow.
Hopefully it comes out a lot in the winter time.
Right.
New York State.
Well, BJ, is there anything else that you want to share?
You know, just get out there, let the people in your community see who you are, because you have gifts and talents that you could offer somebody. Don't think you don't. Don't sit on the sidelines. Don't wait for somebody to offer you an opportunity to make a difference. Make your own way through that door, because if you have a partner, they'll open it for you. Like Greg is going to be my partner on so many things now, I have a feeling.
Oh, I feel like I'm getting roped into a lot of stuff.
But you don't have to wait for that partner. Make your own way into a meeting. Have that seat at that table. Let your voice be heard, because it matters. It matters to me, and I don't even know who the audience is I'm talking to, so it should matter to you.
What a great point to end on. BJ, thank you so much for taking time to talk with me today, but more importantly, for the incredible work that you're doing in this field.
Thank you so much.